So I give you guys a little editorial comment. You've come a long way. It was an hour-and-a-half flight for me. You guys have come a long way to Chicago for ASCO, and the European ESMO meetings in Barcelona, those are fabulous meetings. What do you get out of coming over to ASCO that makes it worth the trip? Other than just seeing me.
Yeah, but you come to Barcelona.
I do.
In any case, so we will see you also there.
So what brings you here?
ASCO is really, I really love the ASCO meeting because it really brings the world together. And it's not only limited like the Barcelona meeting to GI cancers, we also learn so much from lung cancer, from breast cancer, from being interested in renal cell cancer also from this. So therefore having the world of oncology together for a few days, this is for me a part of the feeling here.
It is fun.
So I think that even in the era of fabulous media and the internet, face-to-face global meetings where you put all together and you have the opportunity of networking, of listening, of discussing, is helping you in different things. First of all, to understand diversity and to learn that the way you think is not always the only way to think. Could be right sometimes wrong. So if you face yourself with different way of thinking, like our colleagues in Asia, the Americans, Latin America, this is very important. And then, as Dirk was saying, will give us the opportunity of getting a very important, quick educational update on tumors that we rarely see or we want to.
For example, that means you actually go to those other sessions?
When I have time, yes, of course. And I do selection for that because there are always some sections that we are doing and going there.
Yeah, no, it's terrific. I couldn't agree more. So this has really been a terrific discussion. We've reviewed a lot of important information about the global perspectives related to the treatment of metastatic colorectal cancer. But before we end, I'd like to just get some thoughts, last closing thoughts about our panelists. What sort of news from ASCO that we're going to hear about over the next few days do you think is maybe most important and practice changing?
Right. For the whole world of oncology, I would say, of course, this beginning story of immunotherapy, we learn more and more. And for colorectal cancer specifically, of course, also immunotherapy. And the facts we discussed, that it is not so easy to tailor treatment because it remains to be complex in these factors which make decisions.
Fortunato, it's always hard to be second when you ask, so I've set you up. You got to get another one.
That is intelligent. To what Dirk said, that of course I agree with. I think that the more we study colorectal cancer, the more we understand that it's complex. The risk is that we are overwhelmed by the complexity, and we don't understand or we minimize the big results we got. You remember when we had only FU, median survival, even within clinical trials, was between 6 and 12 months. And now we have patients that live longer, they have extended life due to a multidisciplinary approach, surgery plays a role, even something heretical like removal of multiple metastases is sometimes done. And all the complexity of biomarkers is really a big challenge for us. And now, as an old oncologist, also to learn about immunotherapy is my biggest challenge now.
We have to go back to school a little bit. Fortunato, Dirk, I just want to thank you one more time. So on behalf of our panel, we really want to thank you guys for joining us and hope you found this peer exchange discussion to be both useful and informative.